In the state of Wisconsin, children enrolled in the Children's Long-Term Care Support Program and other Medicaid disability programs are now eligible for the COVID vaccine. This group became eligible March 1st, but again, as the state reminds us, this is only as supply is available that an appointment can be scheduled. Let's take a closer look at who we're talking about. We're focusing on children age 16 and older that are enrolled in one of the following programs, either a Children's Long-Term Support Waiver Program, the Katie Beckett Medicaid Program, the Children's Community Options Program, Children Come First, Wraparound Milwaukee, or Children with Medical Complexity Program participation. Now, remember, the family caregivers of these children are also eligible for the vaccine. They were actually eligible in an earlier priority group because they are considered frontline healthcare personnel. This includes both paid and unpaid family caregivers of children in special needs programs like the ones we have just identified. It also includes those paid and unpaid family caregivers for individuals in family care partnership, and the IRIS program. Now, we're spreading the word because some children in these children's long-term support programs and their paid or unpaid caregivers are not aware that they are eligible for the vaccine. And some providers, public health departments, and clinics that are administering vaccines aren't aware either. Proof is not required to get the vaccine, but some families have found it helpful to produce a letter showing their children's enrollment in, say, the Katie Beckett Medicaid program, or a listing on the state of Wisconsin's website that tells that these children in these children's long-term support programs or other Medicaid disability programs are indeed eligible at this time. And we provide the link to that state listing that can be used if you need to show that this is appropriate at this time. Now, where you can go for help. Some local public health, tribal health, or provider websites can be helpful. The state of Wisconsin, like we said, has not only that listing of who's available for the vaccine in which phase, but also more frequently asked questions in detail that might be supportive. Wisconsin's also operating a vaccine call center. You can call for help or to ask medical questions related to the vaccine. And we give that phone number in the description below as well as on the slide. And the Wisconsin Board for People with Developmental Disabilities has produced a very handy fact sheet that is specific to children in children's long-term support care programs, as well as other Medicaid disability programs. That fact sheet is something you can print and distribute and share. Now, a couple key takeaways. First and foremost, patients. There are priority populations that can schedule to get the vaccine, but again, vaccine supply is more in demand than is available. So we have to be patient with this. We also can to spread the word. First, understand if you fall into one of the priority populations and help the medical professionals and the vaccine administrators understand that priority list as well. You can use the state website or other local websites for guidance in these conversations.